you all on this webinar. Okay. I heartily welcome to our speaker, Dr. Prakriti Patil, who is a consultant occupational therapist at Civil Hospital Ahmedabad and SSG Baroda. She having 9 years experience and she has treated more than 5,000 patients successfully. She has also delivered conferences and the workshop at different levels. So now I request to Dr. Prakriti ma'am to please take this online platform and share their knowledge with us. Ma'am, please.
Hello everyone, this is Dr. Prakriti, occupational therapist, as already Dr. Nilesh has introduced me. I'm recently working in civil hospital. So today we're gonna share some knowledge about like sensory development and delays. Dr. Nilesh, should we start with the presentation?
Yes, ma'am.
Okay.
Yes, ma'am, please.
Am I audible?
Yes, ma'am, you are audible.
My slides are visible?
Continue. Yes, ma'am, it is visible. Okay. Please continue.
So our today's topic is sensory development and its delays. So now why we are discussing this topic at this point of time? So being a physiotherapist or paramedic staff, usually we have patient at our clinics or our clinical setups or at your colleges or anywhere. We usually concentrate on your physical problems. Our more focus is on muscle tone, muscle strength, some anatomical structural problem after like surgery or fractures. So our more focus is usually on tone and muscles, strength and everything, right? Like physical problems. But we just it like sensory problems is just slipped from our mind. So why it is so important? Because in general population, 5 to 15% of our population is affected with sensory problems. The problems which is outcome of some sensory developmental issues. That's why the people is having problem in their ADL life or the developmental problems or any other problems. And in autism spectrum disorder, which is the most difficult disorder to deal with, the ASD, right? So 80% of ASD patients have problem with sensory delay or problem with because of sensory delay. So these are the points, major points, which we are going to cover today. First is case study, then sensory system and pathway, then types of senses, then milestones, arousal level, and disorders and delays. So first I'm going to show you some case study. So this child came to consult for me, right? So this, if you have noticed in this child is absolutely normal with the muscle problems. He just don't have any hamstring tightness or any other muscular problems. Child still walks on his toe. So if you can judge it out that why it is happening, motor part is normal, absolutely normal. Like motor part, I'm talking about the muscles, hamstrings and other muscles are normal. Still the child is walking on his toes. why it is happening. So this would be our case 1. Just take this video in your mind and we'll discuss why it is happening later on. So this is second child I'm showing to you. See the video. If you have noticed in this child is not allowing therapist to touch him. Why it is happening? He might have some sensory issues. The sensations by touching the therapist is not pleasant for him. Why it is happening? Okay, this also we'll discuss later on. Okay. In this child, you must have noticed that child is leaking his hand after every putting every peg, right? So why it is happening? Like what are sensory he's seeking of? Why he's banging his hand on his mouth? So these are some abnormal and clumsy behavior. Why this is happening? So these are the reasons why we need to concentrate on the sensory part, because if you can see this, all three children physically they seem absolutely normal. If you have noticed this thing, that there is no structural problem, there is no anatomical problem, you can see, right? So now comes the main part, like what is sensory system. So if we discuss about the definition, then sensory system is a part of the nervous system responsible for processing information, sensory information. And sensory system consists of what? Receptors, neural pathways, and parts of brain involved in sensory perception. Okay, so now sensory system works by the stimulus, which we call as modalities even. So stimulus can be of two ways: external stimuli such as light, sound, touch, etc., and internal stimuli would be proprioception and vestibular. So now we'll discuss pathway. Pathway you have already learned, and you have studied in your anatomy and physiology lectures. So I'll just brief it out, that when the child gets appropriate stimulus, the electrochemical changes in nervous system will occur, and then changes in the membrane potential of sensory neuron. Then it triggers an action potential, which will transfer the information from sensory organ to spinal cord, right? And then spinal cord to brain to thalamus mostly. And like when it is visual information, visual stimulus, then directly from the stimulus to brain to thalamus to cerebral cortex, and cerebral cortex to associated cortex for detailed analysis. This is how sensory stimulus both transfer from sensory organ to your cortex, associated cortex for analysis. So this is very brief. You have detailed things in your anatomy. Okay, now we'll discuss 7 senses. Like sensory system has 7 senses. So first would be visual senses, which is your vision. Then second is your auditory. Auditory is also known as hearing sense. Then third is tactile, which is your touch. Fourth is olfactory. Olfactory is your smell. Then fifth is gustatory, which is your taste sensation. And then sixth is your vestibular. Seventh is proprioception. So now why to discuss this sensory system development is so important, because if your sensory system doesn't develop properly, you would face some motor problems. You may have developmental delays kind of thing, processing disorders, and so many problems. So uh, to develop a child physically and mentally or cognitively proper, you need to have all proper seven senses, which is the right just right point of arousal level, so that the sensory integration would take place and then you can develop properly. That's why all seven senses should be up to the mark. Now, what are the basic role of each senses, we'll discuss. Okay, so first is your visual. So usually we think about that visual sensation is responsible for sight, which is your vision. It is not restricted to that only. Visual sensation is also responsible for perception, what you see and what you understand, right? So the visual sensation is responsible for that. Then recognizing object and the environment. If you can't see, you can't understand what the object is and what the environment in you are, right? uh, if I tell you right now that apple, you will visualize an apple of a normal size with a red color with particular shape. So to recognize the object and the environment, like if I'm talking you about beach of Goa, you will visualize that. Even if you have not been there, you still recognize that, because there you have seen some visual photos or some videos of Goa, right? So this is your recognize of objects and environment. This is completely based on your vision. Whatever you see, it is stored in your visual memories. And then when you talk about that, whenever somebody is telling you the name of that object or environment, then you can relate with that, right? So and again, visual sensation is responsible to react to the environment. Like if you are in a particular situation, you are supposed to respond the way it is desired. Like if you are in a classroom, you see the classroom and you react accordingly. It is not that you behave same in classroom and at the home, right? So visual sensation is also responsible how you react to a particular environment. Then visual sensation is very much needed for language and vocabulary development. How it is important? So if you can't imagine what I'm talking, right? So you can't have that vocabulary. The just I give you example of apple, right? If I tell you apple, then you will visualize that. So it is developing your vocabulary. The time you want to talk about apple, you will visualize that, you will say that. So it the more you see the objects, the more you see the environment or things or whatever, that will encourage you to develop your vocabulary and the way language. Then visual sensation is obviously responsible for color identification. Then for OTs, eye-hand coordination, it's like our USP, right? So if there is no eye-hand coordination, person can't do almost every work. Like if you want to write, you need to have eye-hand coordination. If you want to do ADL, that is activity of daily living, like buttoning, unbuttoning, donning, doffing your clothes, you want to prepare some food, or whatever you want to do, you need your eye and your hand, and that should be coordinated. That should be that whatever your visual impulses are there, and they should be analyzed and processed, and that then there is a uh, outcome. Then your motor part, your hand should react the way it is desired. So there should be eye hand coordination. If eye hand coordination is not there, first and foremost thing, your physical growth will not happen. See, the child will not able to crawl even, right? So this is even important for your physical growth. Then spatial perception. Spatial perception is what? Where like in text reference to the environment where exactly you are. That is your spatial perception. If I ask you to close your eyes right now, you know where you are sitting. Still, if I ask you that just close your eyes, you would be having some insecurities about your balance, what exactly happening around your environment. So to know the spatial perception, you need to have visual sensation very integrated format, right? Then for the depth perception, uh, okay, so depth perception means person should know that the thing is how much near or far from that person, or how much shallow or it deep. Likewise, if I tell you just close your eyes and step down from your home, you are doing that activity every single day, that you are going down, you are climbing stairs and everything, but still you need vision for that. Otherwise you will feel insecure, you feel balance problem or something. That's why you start walking or like climbing or whatever, you that activity will be slowen down. So for depth perception you need vision. Then to develop reading and writing skill, that is very obvious. Then second is your auditory, that is your hearing, right? So auditory is sense, auditory is responsible for sense and interpretation of the sound. So again I'm telling you, this is, I'm talking about sound, not language. Sense and interpretation of sound, right? So what is difference between sound and language? Sound means if I'm talking to you right now in English, you can understand because you know the language. Even if you don't understand the language, still you will come to know that I'm taking a lecture, I'm talking to you, or I'm teaching you, right? But you will at least, and you can at least discriminate that I'm not shouting at you, or I'm not scolding you, or I'm not having some fight with you. So by the tone of the sound you can sense and interpret of interpretation of the sound, right? So that is auditory is responsible for that. Then for determination of the direction and source of the sound. So auditory system is so accurate that in newborn even they can determine the direction. If you call a newborn, like 4 5 days of so I think 1 month of age of baby, you call him with the sound like babu, whatever his name is, right? So he will respond, and he will turn his head towards the sound direction. So auditory is responsible for determination of the direction and source of sound. So if you can listen a sound of a train, you can understand that this is a source of the sound. There is like lot of sound, variety of sounds, right? But the source you can relate. Like if you listen a voice of a whistle, you can relate that if it is a home and you listen a whistle, then you can understand that it's something cooking inside the kitchen. Then if your mother is calling from another number, even if then even you can understand that source of the sound is your mom, right? So you can relate that, where the sound coming from which object or what person, you can relate that. So that is depending again on auditory system. Then understanding and judging danger, how it is possible. Then see, such as car or fast train coming towards you, even if you haven't noticed with your vision some voice coming towards you, you will realize that something fast, very fast coming towards you, right? So that is because of your auditory system. Again, auditory perceptual skills. So if you have noticed, some people have very sharp memory of the voices. See, if you have noticed, like some of your relatives or friends have that habit or a memory or a skill, that even if you call that person after 2 or 3 years, they will recognize you by a call. Like just you say hello kemcho or hello how are you, they'll realize that this person is so and so, and they will relate it. So this is based on auditory perceptual skills. How better you are in that, the will, like that skill is depending your perceptual skill of your auditory. So uh, there is nothing like that you can't do. You have to just memorize those things, that you have to be very conscious about while listening to a person. Then you can memorize her voice, because every person has a different uh, tone or something. Like you can judge it out, okay, that person is that or not. Okay, so moving forward, our next sense is olfactory, which is your smell. So olfactory receptor neurons in nasal cavity have receptors that bind to odorant molecules. So they are responsible for your smell. So olfactory is responsible for smell is pleasant or unpleasant. You like some smell, you don't like some smell. That is even individual like customized kind of thing. If I like petrol smell, you may not like, but then it is individual thing that your olfactory system will decide that what you like and what you don't like, right? Then olfactory system has ability to differentiate two smells. If you have two smells in the same room, like if it is there is a flower or like some mogra kind of thing in the room, and there is a socks kind of dirty thing, you can smell both simultaneously and separately even, right? So uh, olfactory system has that ability to smell and even differentiation of two smells, then making us alert from danger. Olfactory may have that ability that if some fire or some smoke or some fishy thing is happening, you can smell it. Like if petrol is leaked somewhere, you can smell it, that there is some oil spilled somewhere, or you can smell that gas is leaking. You can have the smell that fire is there is some fire somewhere. So you can alert yourself, you can organize yourself, and you can run, you can call someone, you can ask for the help. So olfactory is also responsible for alerting you in a dangerous situation. Then the next sense is gustatory, which is your taste. Okay, so glands present on tongue is responsible for perception of taste. Usually gustatory sensation is like inbuilt kind of thing. When you are in womb already, you have that sensations. So but yeah, that develops day by day, year by year. Like uh, the glands can discriminate between sweet, sour, salty, and bitter. With ages, you can even judge that it is how much sweet it is, like it's less sweet or too much sweet. So it will definitely increase, get better year by year, but it is like inbuilt kind of thing. And mostly if you have seen, uh, whatever mom eat during pregnancy, what she loves eating during pregnancy, child will automatically have that taste buds, and then the child is more likely to have likings about those food. So yeah, gland is one of the thing which comes inherited, like from your womb, your pregnancy time. Then glands I have ability to judge whether the food is stale or fresh, like is it edible or not. Like you can judge it out, like if someone is giving you stale food which is not good for health, you can refuse by having sensation that it's not a good food. Okay, so moving forward, tactile. So this is very important, because tactile sensation is so important that it works like your second eye. Even if you don't have vision, like visual impaired people or partially visual impaired or blind people, they still work, they still manage their areas, they still get study, just because of their tactile sensation. You can improvise each and every your sensation. See in visual impaired or visually challenged, or like partially blind or blind people, they work on their tactile sensation so well that they are, it is their second eye. Tactile sensation, like what is the sensory organ? Obviously your skin, which is the largest organ of your body. So tactile sensation is responsible for feeling pain or pleasure. Like if someone is touching you, in a particular way, you can understand that it is pleasant or it is painful. Then to estimate pressure, light or deep, uh, so that uh, you can judge that how much pressure is on you, right? Then sense of understanding the world. Tactile sensation, you can explore, you touch everything, you touch every object, every material, everything, and then you can understand the world. The more you explore yourself, the more you explore your touch, the more you will understand the world. Then it is obviously very much useful to understand temperature. Then for the quality, to feel the tactile quality of the material, like it is cotton or lycra material or something else. And yeah, of course, like tactile sensation, we as in OT, we work most like emotional development. For emotional development, like ASD patients, autism spectrum disorder, they don't have emotional attachment towards their parents even usually, right? So we work on the tactile sensations. We try to calm them down when they are hyper. We try to manage and change or alter their arousal level, so that they can get sensory integrated and they can have emotional quotient very good. So what is arousal level? That's again a new question. Okay, so now uh, to the second thing, vestibular, that is your balance. Okay, vestibular is located in your inner ear. Hair cells in the inner ear have cilia that move in presence of your sound. So vestibular is responsible for sense of the balance, and then head and body posture, maintaining head and body posture. Then speed and movement. So vestibular is mostly uh, responsible for your motor growth, like your physical growth. Uh, if your vestibular is very nice, you can do gymnastic or something. Like if you have noticed, we can't walk on a very thin wall or some, like, wavy roads or something. But if you have noticed that we can't walk on rope, but on roads you can see those small little girls, they are walking and dancing on rope. Even in on a higher level, like some 6 of height, they are not afraid of that because they have worked on their vestibular system. So you can every time improvise your vestibular sensation. It is just a sensory integration. The more you practice, the more integration happens, and the more you can be coordinated in the movement. Then your next sense is proprioception, that is your body awareness. So, proprioception is responsible for body position, awareness, and determine our position in space. Then, uh, to have a sense of heaviness or something like force coming towards you. So, if you have noticed that, why, like in day-to-day life, where proprioception you usually use, even if you go for vegetable buying, you have this sensation. If you go for tomato shopping, right, tomato buying, then you will press it down, right? You will how you check the quality, you press, right? So that comes your proprioception. You will not press tomato like you are just squeezing it, otherwise it will get ruined, right? So how much pressure you want to keep, that depends on your proprioception. So that if you have good proprioception, you would have good understanding of the things, right? Then regulating your emotion, like if someone is giving you tight hug or something, that proprioception will decide that you like or you don't like. Okay, so here we end with the what are the roles of senses in our development. So if any one of this is getting impaired or something, like disturbed sensory development, then you would have problems in this kind of development. Okay, so now moving towards next, our point is milestones. Okay, usually you have learned that milestones, like physical milestones, cognitive milestones and everything, but right, but you have never listened about the visual milestones or olfactory milestones or gustatory milestones. Here we're gonna discuss some of those points. So first is your visual development. these are the milestones. At the time of birth, eyesight is very poor. Child can see, like infant can see only till the 8 to 10 inches, that is 25 centimeters, not beyond that, right? And infant can blink to respond to, like, bright light or touching eyes. So vision is almost very poor, right? At the age of 1 month, babies start looking at like pictures or some black and white images, not properly colored images, right? A child cannot see colorful things at the age of 1 month. uh, At the age of 1 month, child watches parents closely, and till that age, till many of you would not know that while newborn is born, there is no concept of tear. That's why they cry at the point of their birth. Still there is no tear, because tear begins to work at the age of 1 month, right? So these are the things you have to take care about, that where the things come, right? Then 2 to 3 months, child begins to see an object and as a one image. Till that, it is very blur image, right? At the 2 to 3 months of the age, it gets clear image, right? Then they start looking at their hands. That is because of this, they have that body schema development, right? They follow lights, faces, objects around them, but still with very rough kind of images, not so clear. Okay, so this is for body schema development. Then moving forward, that 4 to 5 months, they try to reach objects around them. They stare to blocks, they see themselves in mirrors, they play with their own hands. These activities start uh, happening because they can see those images or the objects, right? At the 5 to 7 months, child have color vision. Now they can see colors. So now you'll understand, if you show some, like, 3 or 4 month baby that this is red color or blue color, they'll not understand what is red or what is blue, because they don't have that concept. Till that, there is no color concept. So that concept start with the age of 5 to 7 months. So this will help you what to design at what age. When baby comes, like early intervention program, the baby comes to you for like a palsy or something like that. So you know what to show them at what age. Like if you have 1 or 2 months old baby, then you need to show him some black and white toys, or like uh, uh, some blocks kind of things, so that they can relate with that. Don't show them some visual colorful things, or don't expect from them that they understand the colors. Then at the 5 to 7 months, they try to pick up toys, and they start tracking the objects, right? So, and at the 5 to 7 months, they will try to touch themselves, their image in mirror, right? At 7 to 11 months, they can stare at small images, small objects. Till that, they were like, they can see the huge, like some big things only, some big objects only. Now they can even see the small things, like and they start having depth perception. At the age of 7 to 11, you can start teaching them peekaboo kind of games. Then 11 to 12 months, sorry 11 to 12 months, uh, they can track fast moving objects. Even at 12 to 14 months, they can some do some backboard activities, like stacking something, or looking at some pictures. They can relate to recognize and identify the objects they are familiar, like remote, or some mobile or laptop, or some the things which is usual for them, like car or doll, or what with what they are playing every single day. Then they'll recognize their own self, own face in mirror, right? So there are this kind of milestones. Right now we are just concentrating till age of 1.5 or 2 years, because this is I'm teaching you, I'm just explaining you just early intervention kind of thing. So milestones of vision is so long, like it develops till something like 6 years of age, but we'll discuss till the 14 or 15 months only. Okay. So now auditory. See, auditory is also responsible for hear and sound. If you can hear, if you can listen, then only you can speak. That's why if you have deafness, then you mostly have dumb. You are already dumb because you can't listen, then you can't speak. So auditory is responsible for both the things, hearing and speech, right? Then at the birth to 5 months, baby reacts to loud sounds. From where sound is coming, source of sound, then they respond to some giggles, kind of goo 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 goo, coos or cries or fuzzies kind of things. They make noise when you talk about. They like try to imitate you, kind of thing, right? They they uh, they try to cope up with your voice. If you are happy, they change their voice. If you are shouting at them, they just settle down. So accordingly they will do that. And at the age of 6 to 11 months, uh, they understand no, baba, mama kind of thing. They try to communicate with actions and gestures. So then they try to repeat your sounds. Okay. At the 12 to 17 months, they produce variety of non-repetitive siblings like Bama, Baba kind of things, right? The attention to the book or toy, they would not have that attention deficit kind of problem, that they will play with a toy more than 2 minutes, right? Then they follow some simple directions like go to kitchen, go to room, go to your bed, kind of things. They will understand those things. Point to the objects and pictures in the family members. Okay, so we'll discuss till here only for the auditory milestones. Auditory system develops till almost 7 years. Okay. Then olfactory in newborn, they in newborn even they can smell your familiar scent. Like the parents usually put some perfume, then they can recognize that. They babies can recognize breast milk smell. They can recognize familiar scent for even emotional and bonding kind of thing. Like the if you put the same perfect scent every single day, they would have that feeling that this person stays with me and I'm safe with this person. So that is for your bonding and emotional development. At the 1 month age, uh, getting used to different smells. Still aromas overpowering. That's why if you merge some strong smell during eating, they might refuse eating. Okay. At the 3 month of age, they are more aware of people around them by themselves, smells only. uh, if baby is feeling insecure or scared or threatened by particular person's smell, they relate person with the smell, right? So if they feel insecure and threatened, they will start crying or kicking his leg, like they are refusing that person to come near him. Okay. At the 6 month of age, babies has started solid food, right? So now they would have more sense of smell. They will also react if their favorite food is preparing in kitchen. They will start smiling or pointing or making noise that they are happy that their favorite food is cooking. So they can now relate the smell. At the 12 months of age, they would be having their liking and disliking about the smell. So the olfactory sense is also continue to develop till the 8 years. So now tactile, your uh, touch. So it is highly sensitive. More mouth, cheek, face, abdomen, and sole of feet is more sensitive. Mm, Skin is vital organ to develop communication, as already we discussed. 1 month, baby will respond grasping your finger while you touch him. Then at 2 to 3 months, they will love gentle touch. They like soft things only. They don't like hard or some rough textures. At the age of 2 to 3 months, you need to have some soft items around him. at the age of 4 months, muscles are growing and strengthen, especially arms and hands. That's why they try to reach every object, whatever the texture is. At the 5 months, they try to pick up and hold the objects. They feel the textures and mouthing is still there. At the 6 month, sense of touch is improving. They try to manipulate the things, like if you have handles kind of thing, something, then at the age of 6 to 7 months, they will start twisting him or something, like, play with those things. So this is tactile milestones. Okay. 9 to 10 months, crawling will start, and investigation of the things and exposure of the materials would be more. At 11 to 12 months, baby will start exploring every texture, like hard, soft, cold, wet, sticky, or anything. Okay. Now gustatory. Gustatory, newborn is full set of taste glands, and although it takes years for gland to develop fully, like baby is usually, as I told you, they are already born with the taste, the mode, whatever mom has eaten more during her pregnancy, likings and disliking would be accordingly in the babies. Okay. As we have discussed earlier, like arousal level, what is arousal level like? Okay. So arousal level influences sensory integration. Whatever the senses are, how it will integrate. So it depends on your arousal level. With the just right amount of the alertness, we can function more adaptively, skillful, efficiently, and self-confidently. So your sensory system gets sensory integrated. And what influences is it is arousal level. And now what is arousal level? So just right arousal level should be there. What is that? So just right arousal level is able to focus and explore tasks, able to concentrate, some meaningful interaction, eye contact, and self control. Like, okay, if it is not there, then it is low arousal or high arousal. So you must have seen some kids, like they are hyper, they have hyper arousal, that they are doing everything in mouthing. Like high arousal would be having difficulty to transit to bed. They don't sleep very easily. They change the things what they are playing very frequently. They have very little attention, uh, and those kind of hyperactive behavior would be there. And if there is low arousal, that would be lethargic. The same way, opposite, like low arousal would be lethargic, disinterested, low physical activities, limited physical expressions, always lazy kind of person. They just want to sleep and don't want to wake up, don't want to learn anything. So that is low arousal. So if you have if like in sensory system, if low or high arousal is there, then it is issue with sensory integration. And what is the outcome is sensory processing disorder, which is like due to your delay milestones or some anything, just because of what is the uh, outcome is sensory processing disorder, right? So, sensory processing disorder, this is even a very large topic, but I'm trying to brief it out, like whatever time is remaining, I think 10 to 15 minutes, whatever. I'm trying that I can cover those things which you can use to judge that patient. Judge the patient coming to you or in your day-to-day things, right? So sensory processing disorder, which is like three major types, that sensory modulation disorder, sensory based motor disorder, and sensory discrimination order. Okay, so this is tactile sensory modulation disorder, which is this person has difficulty in regulating sensory input. So uh, they have uh, tactile defensiveness kind of thing. If it is over responsiveness, so the video we show we see in the early like initial phase, the boy was not allowing therapist to touch him, was over responsive to uh, the sensation. So I'm showing you that again. So this boy is not allowing the therapist to touch him. So this is tactile defensiveness, that don't touch me. I am not okay with this touch, with this sensation, right? So this is clear case of sensory. Okay. Okay, so now what would be the result of over responsiveness? They would have tactile defensiveness, fearful movements, like they don't like swings, or they don't like slides, or like so any of playthings in garden. They are very intolerant to particular textures or food or materials, right? So that is over responsiveness. What is under responsiveness? They are unfocused, quiet, and lonely. Like they just sit, like you feel like that patient has, that child is having depression, but it's not depression. That is under responsiveness. Their sensory system is so low that they don't notice even some sensations. And the third thing is sensory seeking. What is sensory seeking? They usually need so much sensation, that is craving of the sensation. So again I'm telling you, the third video which we see, the boy leaking, this boy is licking his hand every time, whatever he whenever he puts a peg, right? So this is seeking, craving, like whatever comes, they need some sensations, right? They bang themselves, sometimes they are also self injurious, they need so much sensation that they even harm themselves sometimes. Okay, so again moving back. So now our second disorder would be sensory based motor disorder, which usually you deal with, right, in your clinical setups when you are dealing with patients. Poor postural controls, because usually you get physical delayed milestones or something like that, right? So you need to focus on this, on even that if muscle strength is impaired, muscle tone is impaired, disturbed, or altered, or not up to the mark, or it is a sensory based motor disorder. You have to take you need to go for a differential diagnosis, that it is motor problem or sensory based motor problem. So if it is motor problem, whatever you do with the motor part, it is not going to solve. But it is, if it is sensory based motor plan, then you need to work on the sensory, and the motor part automatically will uh, get stabilized, right? You need to work on the sensory system. So they have two types of things: postural disorder and dyspraxia. So postural disorder is poor postural control, that frequent drooling. If you have noticed that in like quadriplegic CP, you usually have drooling like very frequently, but you need to diagnose that it is quadriplegic CP having drooling problem, or like even if even in other patients even you get drooling problem, then you need to differential diagnosis why it is happening. It is because of low muscle tone of the jaw, or because of the sensory based motor disorder, see, right? So then you might have a patient that coming to you that my child is not chewing properly, they just gulp it out, right? Then you need to check that if your masseters are weak, or that is sensory based motor disorder. Then if you have gait training patient, you need to go for that differential diagnosis, that poor depth perception is the problem, or the gait problem is there, right? Then in autistic patient, usually we have that awkward, easy to awkward position. They sit in very awkward positions like W sitting or something. Then you need to see that that sensory based problem is there or a muscular problem is there. Then balance problem, and so on, right? There are so many postural problems are there. Then dyspraxia, motor action problems. So poor motor coordination, planning and timing, organizing and sequencing problem. If you have noticed that you come to know that some child comes with their parents that my child has memory problem. They if we tell them that go in the kitchen and bring this thing, they just don't do that. So do the differential diagnosis that it's a memory problem or sensory based motor disorder, that they don't have planning, timing, organizing and sequencing problem. What to do first, what to do second. They can't they can't understand the complex sequences. They don't understand what to do after what. So that's a sequence problem. Okay, they have navigation problem. If you show them direction, go left, go right, they don't understand those things. Okay, then the last one is sensory discrimination disorder. So again, this is difficulty in filtering and interpreting sensory information, comparing details and regarding irrelevant information, right? So this depends on the system. Like if you have sensory discrimination disorder, again has they can be multiple. Like you may have tactile and gustatory both together, and you may have that only tactile discrimination disorder. Okay, so we'll go with line by line. Like tactile, if you have tactile discrimination disorder, you would be unable of touch. You unable to identify object through touch. Like you can't we girls have habit, like we have bag, right? And we just put our hand inside, and we are very much sure that what we are picking up, like we are picking up comb or purse or like lip balm or anything. But these people cannot do that thing. They need to see that, and then they can pick it up. Okay, so they cannot understand or describe the texture. Then they are impaired social skills. They have eating problems, because they the tactile sensation is problematic. They have grooming and clothing problem because of material. They are intolerant to some materials. That's why. Okay, then gustatory. If you have gustatory discrimination disorder, then you could not identify taste and distinguish between temperature. So what would be the result? That you may hurt yourself by eating so hot thing, right? So that's why it is important. Then third is olfactory, unable to identify the source of smell. Sorry, it is I think mistakenly written. So olfactory is like where the source coming from, uh, source of the sound, right? Sorry, so source of the smell. And then identify the smell. If olfactory is discrimination problem is there, then you cannot judge it out. Then auditory, who is speaking, uh, from where he is speaking, from which distance he is speaking, you cannot judge it out if you have social auditory discrimination problem. And last is visual. Visual would be you would be having depth perception problem. You would be having some tare zamin par kind of thing, that you can't judge, you can't discriminate between P and Q, M and N, 3 and the kind of G and B, right? So you would be having those problems. Then vestibular having body position and head position problem. Then poor perception of the elevation. Then clumsiness and disoriented easily, obviously. And then proprioception, uh, unaware of pressure. They don't understand how much pressure to put while pushing or pulling something. They break things frequently, because they don't understand how much pressure is needed to hold that particular thing, because everything has particular weight, particular texture, so you need to hold it the way it is required. Then difficulty in judgment of the force. And this is very unique thing, introspective. They can't understand the if they are hungry, they having nausea, they have shortening of breath, or they are in necessity of going to bathroom. So this is very very much untouched point, because usually we work on the our muscles, and strengthening of muscles, and trying to educate the child that you are thirsty, you are hungry, but you really don't, you just ignore the sensory part. If you really need to cure the patient, you need to understand if you have to go for the differential diagnosis, that is, it is a sensory problem or a motor problem. So here I conclude my this presentation, and if you have any question, feel free to ask me. Thank you.
Thank you, Prakriti ma'am. Thank you for delivering this lecture. Heartily thank you all for the partial topic and the university. I request you to please give massive therapies from the side, please.
Yeah, my message would be, hello, am I audible?
Yes, ma'am. Yes, we are audible.
Okay. So I would really like that, student to address students that they are very good with their anatomy, physiology in every subject, but they really need to get that knowledge about the sensory system, because if even if you work so hard on your motor system, but your sensory system is not so well, you can't cure that patient so well. So, along with the physical problem, you need to understand the sensory point of view even.
Okay, thank you very much, ma'am. Again, I'll thank to you on behalf of our Parallel Institute of Physiotherapy and Parallel University. Thank you. Thank you very much,
Thank
ma'am.
you so much for having me.